Today we would look at aplastic anemia. In the previous lecture, we talked about anemia of chronic disease. And also we've done lectures on iron deficiency anemia, folic acid deficiency anemia, and vitamin B12 deficiency anemia. So today our focus will be on aplastic anemia, aplastic anemia. So what happens in aplastic anemia and what is aplastic anemia? So in this lecture, we will look at introduction to aplastic anemia. We'll look at the causes of aplastic anemia. We'll look at the statistics or epidemiology of aplastic anemia. We'll look at the symptoms, the laboratory diagnosis. How do you diagnose that a patient has aplastic anemia? Then we'll look at the treatment of aplastic anemia. We'll talk about how to prevent aplastic anemia, and then conclusion. And we would take a case study of a patient with aplastic anemia. So let's get started. As we know, anemia simply means a reduction in the amount of red blood cells or hemoglobin in the blood. And so aplastic anemia is a kind of anemia in which the bone marrow fails to make enough new blood cells. This time around, not just failure to produce red blood cells, but also failure to produce enough white blood cells and enough platelets. So in aplastic anemia, we have failure of the bone marrow to produce enough blood cells, whether it is red blood cells or white blood cells or platelets. But usually what we see is that there is what we call pancytopenia, meaning all blood cells levels are decreased. So we'll have low red blood cell, there would be anemia, there would be leukopenia, and there would be thrombocytopenia. So we call that aplastic anemia. And aplastic anemia can develop suddenly or it can develop gradually. So anytime you see a patient with low red blood cells, low white blood cells, and low platelets, you should suspect that the patient has aplastic anemia. So from this slide, you could see that the bone marrow usually produces all blood cells: erythrocytes, leukocytes, and thrombocytes, all produced by the bone marrow. But in aplastic anemia, the bone marrow is not able to produce enough red blood cells, enough white blood cells, and enough platelets. So here we have a bone marrow. And this slide simply shows that the bone marrow produces red blood cells, white blood cells, and platelets. But in aplastic anemia, this bone has lost its ability to produce enough blood cells. And so we would have erythrocytopenia or anemia, leukocytopenia, and thrombocytopenia. So we would have pancytopenia. Okay. So what are the causes of aplastic anemia? Why will the bone marrow stop producing adequate amounts of blood cells? So that can happen as a result of, number one, radiation and chemotherapy treatment. So in patients with cancer, they are they undergo radiation therapy and chemotherapy. Now, the radiation actually inhibits or destroys red bone marrow cells. And these bone marrow cells, which we'll call stem cells, right? Remember stem cells, pluripotent stem cells and progenitor cells, they are destroyed by radiation and chemotherapy. So there are some drugs that cancer patients are given. The goal of this drug is to kill the cancer cells. Unfortunately, sometimes the radiation and the chemotherapy now damage the blood producing stem cells in the bone marrow. And when that happens, the bone marrow is not able to produce enough blood cells and we have aplastic anemia. Then sometimes exposure to certain chemicals like benzene and organophosphates and carbamates. So these chemicals are dangerous to the bone marrow. They cause destruction of the stem cells and prevent the stem cells from producing, enough blood cells. And then certain drugs that are used to treat rheumatoid arthritis and certain antibiotics. So a patient with rheumatoid arthritis sometimes is given a drug called methotrexate, and methotrexate is a kind of cytostatic drug. And so it will also inhibit the ability of the cells, of the stem cells, to grow and multiply and then produce blood cells. So certain drugs can inhibit bone marrow activity. And then some infections also like hepatitis, cytomegalovirus, and parvovirus also have a way of causing a release of some cytokines that destroy the bone marrow. And then sometimes we'll have autoimmune disorders, such as systemic lupus erythematosus, in which your body produces antibodies against your own cells. And so in such autoimmune diseases, antibodies destroy healthy cells and they could destroy the stem cells of the bone marrow. And that will lead to aplastic anemia. And when that happens, the patient is now not only suffering from the systemic lupus, this patient will also suffer aplastic anemia also. Okay, idiopathic. So idiopathic means we don't know the exact cause. So we cannot identify the reason for the aplastic anemia. So we have excluded, we saw that the patient doesn't have any autoimmune disease, has no viral infection, has not taken any chemical or exposed to radiation, yet the patient still has aplastic anemia. So we cannot identify what the cause of the anemia is. So we say that is idiopathic cause of aplastic anemia. So remember all of these causes: radiation and chemotherapy, viral infection, autoimmune disorders, chemicals like benzene and organophosphate and carbamate, and then some drugs that are used to treat maybe systemic lupus, rheumatoid arthritis, could be destructive to the bone marrow stem cells, thereby preventing the bone marrow from producing enough blood cells. So these are viruses, Epstein-Barr virus and parvovirus B19, that could lead to destruction of bone marrow cells also. Now, here we have epidemiology, or the statistics of people with aplastic anemia. So aplastic anemia affects 1 to 2. Okay, first of all, let's start from number 1. It is a rare disease, so it is not very common, but it affects all ages and all races. Whether you are African or you are Asian or American, you can have aplastic anemia. But of course, it's a rare disease. It's not as common as iron deficiency anemia or anemia of chronic disease. Secondly, we need to know that 1 to 2 persons per year are affected in the United States. So 1 to 2 persons are affected in the United States per year. That tells you how rare or how difficult it is to find patients with aplastic anemia. 300 to 600 new cases develop each year. I think that is around the world. And then it is more common in developed countries. So it is not a disease for the poor people. Yeah, it is more common in, that doesn't mean that poor people cannot get it anyway, right? So it is more common in developed countries. So this is what you need to know about the epidemiology of aplastic anemia. So symptoms, what are the symptoms? How do you know that a patient has aplastic anemia? So remember, we said that in aplastic anemia, there would be low red blood cells, or anemia, there will be thrombocytopenia, and there will be leukopenia. So you would have symptoms of low red blood cells, symptoms of low white blood cells, and symptoms of low platelets, low thrombocytes. So if we look at low red blood cells, anemia, the symptoms would be, number 1, fatigue. So the patient would get tired easily, and then chest pain, pallor, coldness in the hand and feet, dizziness, and shortness of breath. So all of these shows that the patient is lacking red blood cells. And of course, when there's no red blood cells, you know that oxygen would not be efficiently transported around the body, because it is the red blood cell that transports oxygen around the body. So in aplastic anemia, the patient is not able to receive enough oxygen transport, to all tissues. And as a result, you will see all of these symptoms: fatigue, chest pain, pallor, coldness in the hand and feet, dizziness, and shortness of breath. So these are signs that there is low red blood cells. And then you would also find low white blood cells, leukopenia, as we said earlier. And when there is low white blood cells, the patient is prone to fever, infections, and flu-like illnesses. So why? Because we know when we did a class on white blood cells, we said that the functions of the white blood cells are to, provide immunity and defense for the body against invading microorganisms, against bacteria, viruses, and parasites. But now the patient has low white blood cells. So it means that the person is going to have a kind of low defense or low immunity to infections. And when the person would easily get infection. So every now and again, the person is getting sick, getting a bacterial infection or getting a viral infection. And the person will have flu-like illnesses. So it will be like the person has flu. And when there is infection, especially bacterial infections, you would have high fever. So a patient with aplastic anemia will not only have pallor, shortness of breath, chest pain, fatigue, cold feet, dizziness. The patient will also have fever, prone to infections, and would have flu-like symptoms, because the person would get sick every now and again easily, because there are no enough white blood cells. There are no adequate white blood cells to fight against bacteria and viruses. So you find all of these symptoms. And then in aplastic anemia, there is also thrombocytopenia, as we said before, low platelets. And when there is low platelets, what would you see? You would see some red spots on the person's skin. You would see prolonged bleeding. So when the person gets any little injury, the bleeding would last for a long time. And so the person would lose a lot of blood through bleeding. And then the person will easily get bruises. Why? Because your platelets are supposed to, prevent bleeding and bruises. But when there is low platelets, then what will happen is the person will easily bleed. sometimes the patient would bleed from the nose. We call that epistaxis. And then you would see some bleeding under the skin, we call ecchymosis, and some purpura, some kind of purple reddish spots under the skin, which shows that there is bleeding. And the reason that is happening is because of low platelets. Remember when we had a lecture about positive feedback, we said that blood clotting process is an example of a positive feedback, and we saw the clotting factors and how they prevent blood loss and how they prevent bleeding by forming clots. But in this patient, it will be difficult for a clot to form because the clotting factors are not there, because these clotting factors and the platelets are working together. Actually, most of the clotting factors are produced alongside with the platelets. Some are produced in the liver. So when there is no platelets, there would be no adequate blood clot. So a little cut or a little injury would lead to huge blood loss through bleeding. So a patient with aplastic anemia will not only suffer fever, infections, flu-like illnesses, the patient would also have some red spots showing blood gathered somewhere, and then prolonged bleeding and easy bruising. Okay, so you could see here, these are the red spots under the skin. So this is actually blood gathered here, and see this is an example of a bruise, easy bruising, and all because of low amounts of platelets. So laboratory diagnosis, how do you diagnose that a patient has aplastic anemia? So you need to do what we call the complete blood count. When you do the complete blood count, you are going to see pancytopenia, meaning there would be low red blood cells, low white blood cells, and low platelets. So there will be thrombocytopenia, leukopenia, and anemia. And of course, you will see low hemoglobin and low hematocrit level. Then reticulocyte counts would also be very low because your reticulocytes are produced more when there is a kind of regeneration or replacement of, if a patient had bleeding and lost a lot of blood, that your bone marrow begins to produce more red blood cells to replace the destroyed red blood cells. So anytime there's hemolysis, you will see increase in the amount of reticulocytes. So reticulocytes is supposed to be less than 2% under normal circumstances, less than 2% reticulocytes. But in severe bleeding, right, due to what I mean by in severe hemolysis, when red blood cells are destroyed, your bone marrow increases erythropoiesis to produce more red blood cells to replace the destroyed red blood cells. And anytime there is increased erythropoiesis, there is increased reticulocyte count. So you have reticulocyte values greater than 2%. But in aplastic anemia, the bone marrow has lost its ability to produce red blood cells, white blood cells, and platelets. So only very few amounts can be produced. And that means that there will be a decrease in the reticulocyte count. So reticulocyte count will never be greater than 2% because the bone marrow is not able to initiate erythropoiesis. And reticulocytes are precursor cells, to the red blood cells, or the mature red blood cells. So reticulocyte count will be low in aplastic anemia. Okay, so from this table, our red blood cell, normal value is supposed to be between 4.7 to 6.1 per microliter, million cells per microliter in a male, and 4.2 to 5.4 million red blood cells per microliter in a female. So this is a normal component. But in aplastic anemia, it will be far lower than this. maybe the patient might be having 2.7 or 2.3. A male patient will have 2.3, so which is very low, far lower than the normal value. And then hemoglobin also, you're supposed to have 13.8, so 17.2 grams per DL of hemoglobin, normal value for male, and female 12.1 to 15.1 grams per DL. But in aplastic anemia, it will be lower than this. Hematocrit 40.7 to 50.3%, it would also be lower. So white blood cells, 4,500 to 10,000 cells per microliter. So it will be lower than that in aplastic anemia. You have very low, and then even platelets will be lower than 150,000. So you could have platelets of maybe 60,000 platelets or 70,000 platelets, far lower than the normal value. And then for reticulocyte, it will be lower than 0.5, in aplastic anemia. So everything will be low in aplastic anemia. Another way to diagnose aplastic anemia is to do bone marrow test. So you do a bone marrow aspiration. You would find maybe there's some fluid in the bone marrow. So you have to, suction that fluid out of the bone marrow, or you could do a biopsy of the bone marrow tissue. Then you could also do antibody test, because we said that aplastic anemia could be caused by autoimmune diseases or autoimmune destruction of the bone marrow, whereby the body produces antibodies against the bone marrow. So you could do an antibody test to know if there are some antibodies that are destroying the bone marrow and preventing the bone marrow from producing enough cells. You could do other tests, vitamin B12 and folate tests. You could do some liver tests and viral tests to know if there are some viral infections that are responsible for the aplastic anemia. You could do X-ray also. You could do CT scan. You could do some ultrasound imaging tests just to be sure to find what the problem actually is with the bone marrow. Most times, you find that the bone marrow is replaced with some fat tissues, so the stem cells and the osteocytes are replaced with some fat tissues, and they cannot produce enough blood cells. So how do we treat aplastic anemia? So you do what we call stem cell transplant, because the stem cells in the bone marrow cannot produce bone cells. They've been destroyed, maybe by some antibodies or by some viral infections, or by radiation and some drugs. So you have to do a transplant. You have to remove those stem cells and get fresh stem cells to replace them. Then you could do immunosuppressants. So we said that in autoimmune diseases like systemic lupus, erythematosus, antibodies are produced by my body against my bone marrow. And that is because I have a hyperactive immune system. So what I need to do some kind of immunosuppression. I need to take some drugs that will suppress that hyperactive immunity, thereby preventing the formation of antibodies that were destroying my bone marrow. Okay, so you do immunosuppressant. Sometimes you do a blood transfusion. So since the patient is lacking red blood cell, lacking white blood cells, and lacking platelets, you could get somebody else to donate, blood. You can do blood transfusion of packed red cells. You could be transfused into the patient to help the patient survive. Then you could take some drugs, bone marrow stimulant, to stimulate the bone marrow to start producing blood cells again. Then if the aplastic anemia is caused by some viral infection and bacterial infection, you need to take antibiotics and antiviral drugs to treat the main those infections. Then how do you prevent aplastic anemia? So you prevent aplastic anemia by avoiding exposure, avoid being exposed to certain chemicals and whatever it is that caused that aplastic anemia. So you could avoid exposure to insecticides, because some of these insecticides have chemicals and organophosphate compounds that are dangerous to the bone marrow. And then some herbicides also, you have to stay away from them, organic solvent and some toxic chemicals. So anything that could destroy the bone marrow, you have to avoid it. Okay, so conclusion. Aplastic anemia is blood disorder that can be inherited or acquired, and it is a kind of disease that leads to a serious problem, because when you don't have red blood cells, you are in trouble, because you cannot have oxygen supply. And when you don't have white blood cells, you are also in trouble, because you are going to suffer all kinds of infections. You'll be easily attacked by bacteria and viruses. And then again, if you get a little injury, you're going to lose a lot of blood by bleeding because of low platelets. So aplastic anemia is a very serious condition. How do you treat? As we said, you could use medications, you could just do stem cell transplants, and you could do blood transfusion. So patients are advised to take good rest when it is needed, to avoid contact sports, the kind of sports where you can easily get injured. So avoid such kind of sports, because if you get any injury, you will bruise easily and you would bleed. So because of low platelets. And again, because you don't have enough red blood cells, you don't have enough oxygen supply. So you cannot do very tedious or tasking sports, because you might have some kind of hypoxia and eventually faint. Then be hygienic. So you have to keep your environment clean, so that bacteria and viruses would not easily get to you, since you know that you have low white blood cells that are supposed to fight against infection. So let's take a case study of this patient. So we have a patient who is 46 years old, and the patient is suffering hepatitis C virus infection. And this patient is taking some treatment, combination treatment, and this drug contains interferon, and he takes this drug weekly, and he also takes another drug called ribavirin, 1,200 milligrams per day. So these drugs have some effect on the bone marrow, okay, because we said that some drugs can lead to aplastic anemia, and we also said that viruses can lead to aplastic anemia. So this patient took this drug for 48 weeks, for a long time. So the drugs affected his bone marrow. Now, symptoms we found in this patient: the patient has bleeding tendency. So the patient bleeds easily, and the patient has unexplained fatigue of recent onset. So the patient gets weak easily, and we cannot explain why he's weak. So we suspect that there's not enough red blood cells, and there's not enough oxygen. Physical examination: there is generalized purpura and bruising, pallor of the skin and mucous membrane. So when you see generalized purpura, so it shows that there's something wrong with the platelets, because the patient is bleeding under the skin. So you see purpura under the skin, and then you see pallor of the skin. The skin is looking pale, which is a sign of anemia, and the mucous membranes also are pale, which is a sign of anemia. And then the patient's liver, spleen, and lymph nodes are not enlarged, okay? And then this is the bone marrow picture. So a bone marrow biopsy showing the absence of hematopoietic tissue and its replacement with fat. So I told you before that the patient with aplastic anemia, the bone marrow cells are replaced with fat. So this is what is the picture of a bone marrow with aplastic anemia. So when you have such a question in an exam, or you have a patient with all of these symptoms that we just mentioned, you already know that this patient has aplastic anemia. So how do we treat this patient? So we have to do a bone marrow transplantation, first. But before we do that transplantation, we have to complete 2 courses of immunosuppressive therapy. So the patient has to take drugs that can suppress his immunity, because if you do not suppress the immunity of the patient first and you do a bone marrow transplant, it's like you are taking another bone marrow and putting inside this patient. So the patient's immune system will try to destroy that new bone marrow, right? So we call that a kind of host versus graft reaction. So your body destroys the new bone marrow. So you are the host, and the new bone marrow is called a graft that is coming into your body. So if you don't suppress your immune system first, your body will not recognize this foreign bone marrow that we want to give to this patient. The patient's body will not recognize it. And so the patient's body will produce antibodies to destroy this new bone marrow. So we are giving the bone marrow to this patient to help the patient to be able to produce blood cells again. But if the patient's immune system is not suppressed first before the bone marrow transplant, what will happen is that the patient's body will produce antibodies that would destroy that new bone marrow. And at the end, what we were trying to do, would fail, because the new bone marrow will be destroyed by antibodies. And that reaction might not be good for the patient who is already suffering aplastic anemia. So the first thing you want to do is to give immunosuppressive drugs that could suppress the patient's immunity, so that when you do the bone marrow transplant, the patient's body is not able to destroy that new bone marrow. Okay, so that is why you must do immunosuppression first before you do the bone marrow transplantation. Then another way, you could also give therapy with anti-thymocyte globulin and cyclosporin A. Now, your thymus gland is where your T white blood cells mature. So T white blood cells. Remember, we have a T lymphocyte. Remember, we have B lymphocytes and T lymphocytes. So the T lymphocytes mature in the thymus gland. And most times it is that T lymphocyte that destroys the bone marrow. So what in the pathogenesis of aplastic anemia, bone marrow destruction is done majorly by CD8 plus cells, which are cytotoxic or killer T cells. So they destroy the bone marrow, in autoimmune disease, or when you have some serious infections and your T lymphocytes are activated, they destroy your bone marrow. So what you need to do is to attack the thymus gland to prevent the release of those T lymphocytes that are destroying the bone marrow. And then cyclosporin also is a cytostatic drug that will reduce the immune attack of your bone marrow. So they will help to suppress the immune system to prevent attack or destruction of your bone marrow cells. Yeah, so basically, that is everything you need to know about aplastic anemia. We already answered some questions, a few days ago from the PLAB site on aplastic anemia. There were some questions we answered about aplastic anemia, but I'm going to find more questions this time around on all types of anemia, and we would answer them in the next lecture. Okay, so let's quickly do, in 5 minutes, let's quickly do a revision of aplastic anemia. So aplastic anemia simply means that your bone marrow is not able to produce enough blood cells. All blood cells, whether it is white blood cell, red blood cell, platelet, they are not able to be produced in adequate amounts. and that will lead to anemia, leukopenia, and thrombocytopenia. And so what do you find as the symptoms? You find the symptoms of anemia, pallor, cold feet, fatigue, dizziness, chest pain, and you find all of these. And then you find the symptoms of leukopenia also. So the patient gets fever, infections, and flu-like illnesses. And then you find the symptoms of thrombocytopenia also. So you see some red spots, or purple-colored spots called purpura under the skin, which is as a result of bleeding under the skin. And then you find that this patient will have prolonged bleeding. So when the patient has an injury, blood clot cannot be formed because of the absence of clotting factors and the platelets. And then also, we looked at the causes of the aplastic anemia. We said it could be due to radiation therapy or chemotherapy in a patient with cancer. So we give radiotherapy to treat the cancer, but the radiation could destroy the bone marrow cells, or the chemicals or the drugs that the cancer patient is taking could destroy the bone marrow also. Then we said infection like bacterial and viral infections, hepatitis, parvovirus B19, Epstein-Barr virus could also lead to destruction of the bone marrow. Then we said chemicals like some organic solvents, organophosphate compounds could destroy the bone marrow. Carbamates, could destroy the bone marrow. And then we said also that some herbicides, stay away from herbicides if you want to prevent aplastic anemia, and stay away from organic solvents that are dangerous if you want to prevent aplastic anemia. Then we also mentioned that some autoimmune diseases like systemic lupus erythematosus can lead to the production of auto antibodies. So antibodies against your own tissues, they will destroy your blood cells, and that could lead to destroy your bone marrow, and that could lead to aplastic anemia. And then we said to diagnose in the lab aplastic anemia, you would do complete blood counts, and from your complete blood counts, you will find low red blood cells, low platelets, and low white blood cells. You would find low hematocrit and low hemoglobin. You would find low reticulocyte counts also. And then we said you could do bone marrow biopsy, you could do aspiration of the bone marrow, you could do ultrasound, you could do X-ray. So all of these would show you that your bone marrow cells, stem cells, are not able to produce enough cells, and the bone marrow cells have been replaced with fatty tissue. How do we treat a patient with aplastic anemia? So we do bone marrow transplantation after 2 courses of immunosuppression. So we have to suppress the person's immunity first, so that when we transplant a new bone marrow to that patient, there would be no host versus graft reaction. And then you could also give some drugs, anti-thymocyte drugs, and cyclosporine you could give also. Yeah, so basically that is everything you need to know about aplastic anemia. Do you have any question?
No, sir, I don't have any question.
Okay, good. Thank you so much. So
Thank you, sir.
that will be all for today.